Hey, I'm Dr. Sebastian Gonzalez from the Performance Place. This is going to be part 4 of 5 of our series on how to manage grade 1 and minor grade 2 muscle tears, or as most athletes and people in general will call them, is muscle strains. I know this has been a long time coming for this video, and I know that some of you have been emailing me and asking me when part 4 and 5 are going to be coming out, so I made a push. I did it. These are going to come out, and I'm going to put them really close together. So if you guys want to subscribe to our feeds on the side, that'll take you through part 1 through 3, as well as these 4 and 5. So they should be up at the corners. You should be able to subscribe there, and let's get going. In summary of the last few videos, we'll go over just a rough timeline. So usually people, when they develop a minor strain, they think, oh, I got to rest things, I got to keep resting, or else it's not going to get better. Rest is overused in my opinion, and some of the research does validate this. So about 5 to 7 days after an injury, you can use your things like your PICE method, your ice, heat, compress, elevate, all that kind of stuff. Beyond that, about 7 to 21 days is a time frame where you can use more active stretching, such as your reciprocal inhibition or things like light tissue massage, not necessarily deep but lighter, as well as some passive modalities you'll find in therapy clinics. Now, it's important during this period not to overstretch, because you can definitely separate those fibers that are trying to heal. And in the prior videos, you can go over all the research and the methodology and the reason why I'm recommending this. Today we're going to go over the mid-strength period, which is about 6 to 10 weeks after an injury. The last video we went over what we call the early strength period, which consists of eccentric loading of the muscles, some isometrics, and some deep tissue work. Now, if you have questions upon the exact things to do during that early strength period, you should probably go to that video and watch the thing in its entirety. The mid-strength period is a good time to incorporate 3 different types of contractions, which is used in normal strength and conditioning. That's your eccentric, your isometric, and your concentric. And if you're wondering what those are, basically a bicep curl is a good example of it. Imagine I'm holding weight. An upward contraction or shortening contraction is called a concentric contraction. A slow against gravity lengthening contraction is called an eccentric contraction. And one where I'm just basically holding the weight without moving the arm for a duration of time is called an isometric contraction. Now, when you load the muscle, slow and controlled motion is actually usually one of the best things to use as a rule during this time period, because a lot of times you're not used to the movement, as well as you might be a little afraid, quite honestly. A lot of people have hesitation when they're starting to reload a muscle or tendon that's been injured. However, just consider that usually muscle and tendon injuries happen from quick movements anyways. So starting slow is usually a good idea. So does this mean you should never do any of your rehab or exercise quickly? No, it doesn't mean that at all. However, when you have someone who's injured, or you're injured, you have to just kind of play the game of risk. If injuries typically happen with a quick movement, a lot of times if you incorporate these quick movements, especially under load, too quickly in rehab, a lot of times you'll sustain flare-ups. And having a flare-up as a patient or an athlete is a huge mental breakdown. A lot of times you have to recondition your thought process just to overcome that barrier as well. In addition, more aggressive deep tissue work is usually a good thing to add at this point, which helps decrease the chance of excessive scar tissue formation, which basically leaves the muscle set up for another injury. So this actually accounts for a lot of the reasons why people have repetitive injuries on the same location, on the same muscle or tendon. And there's actually a couple studies, one in 1998 and one in 2001, which validate these points, which I should have surrounding this video somewhere in some text. These articles basically lay out the idea of how this happens, and it says that scar tissue is of inferior quality and has a lower functional capacity than normal tissue, and it actually accounts for the reason why re-injury happens at such a high rate, especially when someone starts to resume activity again, such as their sport, jumping, running, and so on. And I'll actually read this verbatim from my computer down here. Just so you guys can see this is a little bit more excessive terminology, and I'll have this somewhere in the video as well, in the text around it. So the scar tissue that is induced is of inferior quality compared to the original tissue due to alterations of biochemical composition and structural organization, compromising the functional restoration of the pre-injured structure. This leads to high re-injury rates when the athletic activity is resumed. And there's 2 of those studies right here, which I'll include around the area. Let's recap. During this 6 to 10 week period, there should be an attempt to come back to normal strength and conditioning. while adding some therapy-based or focal isolated exercises, as well as adding some deep tissue work to decrease the potential of re-injury. Load upon the muscles should vary, and there's no standardization of how much load to put on the muscle or joint, mainly because people have different grades of injuries. A grade 1 tear might have a different load capacity than a grade 2 tear. It's different time frames during recovery. So a smaller tear can usually handle a larger load sooner than a larger tear could. One of the golden rules of rehabbing and starting to load a damaged structure is basically you start slow and you start to move into it, increasing load slowly until you hit a hiccup. Everyone will have flare-ups, but you don't want the major flare-ups. And if you can imagine your muscle or tendon kind of as, you know, in the movies when people are running through like this jungle and they're trying to get away from somebody and they cross this rickety old bridge, they usually don't jump out on it really quickly and start shaking it, you know, because it's kind of weak and rickety. They test it a little bit and just see, and then they finally cross. Your muscle or tendon is basically the same way as that, and you should treat it as such. If you jumped in and started doing a very high load squat on, say, a quad injury, then you're basically asking for yourself to basically fall down that cliff and in the river below. So it's a very high risk activity unless you build into stuff. You have to test the water before you actually go in completely. Obviously, when testing out loads, these should be done under the supervision of a qualified professional. And I'm definitely not telling anyone to self-treat. And in my experience, the people I've noticed self-treating, oftentimes they wait a long time because of lack of education, or they just feel like if they follow this terrible treatment plan that they developed on their own, they might be a CPA and they don't know anything about the body. Sorry, CPAs, you might know something about the body, but generalizing anyways. So basically what it comes down to is a lot of these people rest for a long period of time, and they might be 6 months into their injury and they've lost a huge section which they could have been doing a lot of things. And if you've been watching these videos, you'll see that we're only up into 6 to 10 weeks. So if you've been resting for like 6 months, then I think you've missed a lot of recovery time which you could have had. So if you do have an injury, I suggest going back and watching all the other videos in their entirety and just going through the entire series. I can't tell you enough that education on a patient's part or an athlete's part is very important, because if you guys are active, you're not going to just get these things one time. You're going to get a lot of different things. And I always kind of joke with the people that I see is that we end up living for a very long time because we're athletic, but we have all these little crummy injuries. And the people that are not athletic, they don't have all these little crummy injuries, but they end up dying of heart attacks and much sooner in life. So know what you're going to have to get into if you're athletic, and get your education right now. Next video, we're going to be jumping right into the late strength period, which is basically the last video I'm going to do in this topic in regards to the 5-part series. So definitely stay tuned for that one. But in the meantime, I think you see that it's very important to educate yourself, and that's the whole point of these videos. If you have an injury, you should be going into your doctor, chiropractor, or therapist office and basically know more about this specific condition than they do. We do see a lot of variety of cases, and we learn things every day. But at the same time, we're going to be able to relay information back to you and educate you further if you have the basic knowledge of what a joint is, what joint mechanics are, what cartilage is. And a lot of times people in general population don't know those basics. So you should educate yourself now. And if you do want help from me, you can always call our office or just go to p2sportscare.com. We do offer some talking over the phone. We don't like to say consultations or treatment plans, because basically you can't treat someone who you haven't seen yet. But this type of stuff that we're going over today, I mean, basically we're looking at theory. And if you understand theory, you can develop a plan of attack or talk to your doctor more effectively than if you didn't know anything at all. So if you do want to talk to me on the phone, that is available to you guys. You just have to basically do it for a small fee, and I'll be 100% attention on you and what you have going on. I've found, and I know a lot of other healthcare professionals have found the same, is that a sense of fear or a not understanding the plan of attack on the patient or athlete's part is one of the biggest factors of their recovery or not. And hesitation of going forward in even the correct treatment plan is a huge issue. So the correct treatment plan might be in place, but the person not wanting to go through it for whatever reason is basically the factor which we can't control. So if you want to talk to me on the phone about that, I can do that as well. That's all we have for now. Just don't forget to get connected to our emails. Our emails have feeds to things like our podcasts. Articles have been written by me and my staff. and just really good information that we haven't been able to put on YouTube yet. So YouTube's great, but at the same time it takes a lot of effort to produce these videos and everything, because gotta look good, gotta get lighting, gotta make sure it's edited, and a lot of times you can get words or audio done a little bit quicker. So remember, guys, I'm here to help. And get connected to the Performance Place. I'll help you out as much as I can, and hope to see you guys next video.